Welcome to AETCM, the emergency medicine channel. So in this last part of cardiovascular emergency, we are going to deal regarding the vascular disorder. Three major conditions we are going to discuss. Two things regarding our arteries, aortic dissection and then aortic aneurysm, and then another one is acute limb ischemia. Third one is related with our vein system, that is deep vein thrombosis. So before that, that is the normal anatomy of our artery. So tunica adventitia, tunica media, and then tunica intima. So intima is a thin innermost layer, media is a thick elastic middle layer, adventitia is a thin outer layer. So right. So first topic is a aortic aneurysm and dissection. So before that, what is mean by aneurysm? What is mean by dissection? So aneurysm in the sense widening or outpouching or dilatation of your blood vessel or wall of the chamber of the heart. So it is called the aneurysm. So dissection in the sense, dissection means what? It is a cut or separation. So there is a separation between the intimal and then adventitial layer. So separation between the innermost and then outermost layer. There will be a separation. So in this image here we can see the separation. So this is the innermost layer. This is the outermost layer. So there will be a separation between innermost and then outermost layer, that is called the aortic dissection. So what are the complications? Otherwise, what are the things? What are the pathology will occur here means? So first thing, this is the true lumen. So true lumen in the sense, what is the that is the normal pathway. So here I can draw. So this is the this one, and then here it is forming the other pathway. So here it is a true lumen, right? So here it is a false lumen. False lumen means because of the dissection, so it creating some other pathway to approach to the blood enter into the some other pathway. So it is a true lumen, this is a false lumen. So the first complication here it will arise is so the false lumen easily get ruptured. So easily it will get ruptured because the false lumen that will created within some thin layers. So because of the thin layer, easily it will get ruptured. So that is the first important complication. Second important complication here is that false lumen that will obstruct your true lumen. So the false lumen, it will compress your true lumen. Thereby it will reduce the blood flow through the true lumen. That is the obstruction is a second important complication. Third important complication is if the this one a dissection get proximally it is expanding, or proximally if it is going means what will happen. So here we can see here in the distal portion of your aortic arc it is forming like this. So if it is extending into the proximal region means what will happen. So we told obstruction is one of the cause. So it will obstruct here. If it is obstructing means what will happen. So it will affect the brachiocephalic trunk, it will obstruct your common carotid artery, it will obstruct your subclavian artery. So the blood flow through these arteries get obstructed. Again, still more if it is extending means it will obstruct your arc of aorta, that distal portion, the root of aorta, if it is extending, if it obstructing means what will happen. So the entire portion of your aorta won't get blood. Mean the same times the coronary circulation here only it will arise. So from the root of aorta only your coronary circulation will arise. No, so there also if it is that aortic dissection extending means that put pressure over the root of aorta means that will stop the blood flow through the coronary arteries. So these are the some complications that will arise in the aortic dissection. So types of aortic aneurysm, this is the normal blood vessel, saccular and then fusiform. Saccular means that will occur in the one side of the artery. So that is the saccular. Fusiform in the sense all circumference, all side of your arteries. And then types based on the site and causes. So based on the site, we are dividing into thoracic and then abdominal. Thoracic in the sense ascending thoracic aorta, arc of aorta, and then descending thoracic aorta. Ascending thoracic aorta, major causes like a cystic medial necrosis, a syphilis, and then Marfan syndrome. So these two diseases, so syphilis we know it is a sexually transmitted disease. So these two symptoms, what will what will happen means that elasticity of the artery will lose. So this the two disease that will cause the disruption in the elasticity of the aorta. So arc of aorta and then descending aorta, this one it will cause the because of the atherosclerosis. So abdominal, any part of the abdominal, it will happen because of the atherosclerotic changes. So other causes like a high cholesterol level, hyperlipidemia, and then hypertension, and then congestive cardiac disease. So assessment wise, in aneurysm usually it doesn't produce any symptoms until it develops into the large mass. So initial stage it won't show any symptoms. Second thing, again the signs and symptoms based on the location. So same thing. So if it is happening in the ascending part of your thoracic aorta means, so it will put pressure over your aortic valve or in the pressure over your coronary arteries. So thereby it will disturb the blood supply to your coronary arteries. So the person will complain chest discomfort. So if you are seeing the ECG means ischemic, that AST depression or elevation will occur. So if it is happening in the abdominal part means what will happen? So if it is developing like a bulge, the mass like a bulge means again it will put pressure over the some organ, then only it will the person will complain the pain. So based on the location also the signs and symptoms will arise. So again, as the aneurysm increase in size, stretching of the aortic valve will produce the pain. So because of the stretching of the valve, that will produce the pain, and then the pressure of the large amount of blood surrounding organs may also produce the symptoms. So if the mass is if the bulge is getting mass bulge means that will put pressure over the nearby organs. So if it is compressing the esophagus means that will cause the dysphagia, and then if it is compressing laryngeal nerve means it will cause the hoarseness of voice. If it is compressing tracheal or bronchial region means it will cause the difficulty in breathing. So those are the some symptoms will arise. So here the main complaint is the pain. So pain, the onset of pain means abrupt, sudden onset of constant unbearable pain. That is the one of the major important thing. So quality wise they will describe like a tearing or ripping or sharp stabbing knife like a pain. So they will complain like someone stabbed over me on the abdomen. So if it is abdomen means someone stabbed over me abdomen with a knife. So like that they will describe the pain. So it is the nature of the pain is sharp or stabbing or knife like tearing, ripping pain. So region wise, so again it is based on the location. So if it is happening in the ascending aorta, ascending thoracic aorta means the person will complain pain over the substernal or located in the neck, throat or jaw or face. So if it is a descending aorta dissection means that the person will complain pain over the flank region or interscapular region or pain in the back, abdomen or lower extremities. So time wise pain may last for the hours to days. So again the same thing. So if it is happening in the ascending dissection in the ascending aorta means the one important clinical things. So interarm systolic BP difference is greater than 20 mmHg. So again I am repeating. So if the person have a ascending dissected aorta means dissected ascending aorta means the interarm systolic blood pressure will be greater than 20 mmHg. These are the one of the important clinical signs. So while the time of BP taking, that is why we have to take a habit of two side, both left side and then right side we have to take the blood pressure. If the person have aortic dissection means there will be a difference. So interarm BP difference is greater than 20 mmHg. So by the clinicals in pre-hospital we can assume the person have a aortic dissection. So again, so if you want to finalize the diagnosis of aortic dissection means that needs some procedures. So angiography or some other imaging techniques we need. But in pre-hospital those are the things we won't get. That is why. So these are the some other clinical signs we can understand. So again, if it is a disruption in the ascending aorta means again the same thing only, the pathology that will obstruct your subclavian vein, that will obstruct your common carotid artery, that will obstruct your coronary artery. So the same thing only we kept in this slide. So next is dissecting descending aorta. So it will most commonly occur in the older patient, though more specifically those with a history of hypertension. So here the pain wise likely to be somewhat less severe when the descending aorta is involved. So compare with an ascending aorta, here the involvement of descending aorta means the pain intensity will less in descending aortic dissection. So distal pulses may be hard to feel. So this is one of the clinical importance. So if you are palpating the pulse means that is hard to feel. And then rupture of the thoracic aneurysm. So if the aneurysm get ruptured in the thoracic part means the common sites are left intrapleural space, mediastinum, or less commonly in the into the esophagus. So again, rupture of the abdominal aortic aneurysm, that will show the symptoms of sudden back pain. Sudden means the person will complain the pain will onset very suddenly, abrupt onset of back pain, and then that is accompanied by the abdominal pain and then tenderness. Also there will be a abdominal distension will be there. Definitely if it is a bleeding means there will be a hypotension will be there, and then pulsating abdominal mass between the schizoid process and the umbilicus. Those are the some clinical features in the dissecting abdominal aortic abdomen. And then differential diagnosis wise, the person with the symptoms of back pain and then intra-abdominal process. So three major conditions: testicular torsion, gastrointestinal bleeding, aortic dissection. So management, what we can do, so in this case the common step of management, we have to do the scene setup, scene safety, mental status, everything we have to do. Apart from this, we can give the pain relief management. It's one of the primary thing we can do based on your online medical direction. We can go for, if the person blood pressure can able to tolerate means we can go for the opioid drug also, and then we have to apply the pulse oxy, supplemental oxygen. Here if the person developing hypotension means definitely we have to treat with an crystalloids. So here if aortic dissection, the rupture happen means in definitive care will go with some sort of procedure, and then there will follow the massive transfusion protocol. So if you are suspecting hypotension, severe hypotension, or the dissection of aortic aneurysm means you have to contact the receiving medical facility or to ask for the activate the massive transfusion protocol. That is the thing we have to keep in mind. So reassess the patient at least every 5 minutes. That is most important thing. So if you remember our assessment format, there we mention like unstable patient every 5 minutes we have to reassess, stable patient every 15 minutes. So in this category, these type of patient will comes under the unstable category. So as soon as possible or every 5 minutes we have to reassess. So complication wise, aneurysal rupture, infection, thrombosis, embolism, distal ischemia, gangrene, and aortocaval or aortoendric fistula, erosion of vertebra, spinal cord, ischemia. So second condition is acute arterial occlusion and acute limb ischemia. So what is meant by acute arterial occlusion? So arterial occlusion because of the thrombus or embolus or the tumor or direct trauma to your artery or some other unknown causes, it will disrupt your arterial blood flow. It will affect your arterial blood flow. That is called the acute arterial occlusion. So again, if the disruption or the affection of your blood flow to your arteries to your limb means that is the acute limb ischemia. So that is the difference. So the causes might be embolus that begins in the heart and travel to the extremities, any of the several conditions. So again the embolus that begins in the heart and then travel to the extremities. So here embolus is different and then thrombus is different. So both are different. I think one presentation also we discussed these other things. So again I am repeating, thrombus in the sense that is a standing blood clot or localized blood clot. So if the vessel injury happen means here only the blood clot will form. So the injury happen here means here only the blood clot and then platelet adherence everything will happen. That is the standing or localized blood clot. Embolus in the sense moving something. So something in the sense moving something in the sense that might be a air. So air embolism. So the air will travel all the way of your circulation. That is why I told moving something. So that might be a air, something includes that might be a air, that might be a catheter. So in your central line or the peripheral line, if the plastic portion of the catheter get detached, and then if it is circulating in the circulation, means that is the catheter embolism. And then again amniotic fluid embolism. So while the time of labor, so if the amniotic fluid get entered into the maternal circulation, means that will cause the amniotic fluid embolism. And then fourth one is a thromboembolism. Thromboembolism means thrombus in the sense blood clot. So moving blood clot, that is called the thromboembolism. So this is the difference between the thrombus and embolism. So we told the embolus that begins in the heart and then that will travel into the extremities. So if it is forming in the left atrium or left ventricle, means it will get into the systemic circulation. It will other furtherly it will stuck in the some other portion and then it will affect the blood flow. So here in at what circumstance in heart itself that blood clot will form. So three major conditions: atrial fibrillation, this is one of the major risk factor; clot formation in the left ventricle after acute myocardial infarction; rheumatic or prosthetic heart valve; and the left ventricular aneurysm. So peripheral artery disease is the same concept only, because of any atherosclerotic block or direct trauma to your arteries or any dissecting aneurysm, vasospasm that will block your arterial blood flow to your limbs. So that will cause the person will complain the pain or cramping or muscle tightness, fatigue and then weakness while the time of walking or during the exercise. So the reason behind is because of the oxygen, the demand of the oxygen. So if it is a normal case, means easily, so while the time of exercise or while the time of walking, your muscle need a more amount of ATP. So ATP needed means that need if ATP want to produce means that need a oxygen. So oxygen supply needed means, so you need a good peripheral vascular, means it need a good perfusion. So here it is some of the causes it is affecting the perfusion. So affecting the perfusion means the delivery of the oxygen will reduce. So the delivery of the oxygen will reduce means that will cause the put hand on the your ATP also will reduce. So this is the thing. So because of the demand of oxygen demand, it will causing the weakness, some muscle cramping, muscle tightness and then fatigue. So assessment wise, so first while the time of history taking, you have to ask about the whether the symptom arise suddenly or gradually. If the person tell like a suddenly, means that is indicating the embolus related. If it is happening gradually or gradually onset, means that is indicating thrombus related. Causes might be thrombus related. So we have to ask about the patient whether he or she have any previous episode, the same thing previously happened or not. Yes means we have to ask about the either that is a more frequent or how long each event lasts. So on the what was the diagnosis, any treatment last time she took or not, those are things we have to ask. So in this time we have to do the neurovascular assessment, that is the 5 P's. So pain, pallor, pulse, paresthesia and paralysis. These are the 5 assessments we have to do. This is called neurovascular assessment. So pain, when it will arise pain? So if any ischemia to your peripheral nervous system means that will cause the pain. So mainly the person will complain the pain distal to the blockage area. If it is happening in the calf muscle, means so distal to your calf muscle, the person will complain the pain. So pulselessness means again the complete obstruction of the artery means that will cause the pulselessness. So we can't palpate the pulse. So pallor again the same thing, because of the complete obstruction of your artery. Paresthesia and paralysis and then sensory loss mainly will occur in the case of any blood supply to your peripheral nervous system get reduced, means those are the things will cause the paresthesia, paralysis and then sensory loss. So again we have to find out the any risk factor regarding the blood clot formations, like the person using any IV drugs or any heart surgery, acute myocardial infarction, clotting disorder, pulmonary embolism, atrial fibrillation, contraceptive or hormonal use they are taking or not, that while the time of history taking itself you have to take. and then gently we have to palpate over the below the obstruction or below the person complain pain. If the person is complaining cup muscle pain over the cup muscle means, then we have to palpate the dorsalis pedis, posterior tibialis, every pulse we have to palpate. So the skin wise it appears pale or motile distal to or over the affected area, feel cold, cool or maybe either moist or dry. The breath sound usually it will be clear, so it is affecting only your blood vessels. So breath sound wise no problem. Changes in the heart rate and then rhythm that may occur because atrial fibrillation is one of the cause. So that may alter your rhythm. And then if the patient has a symptom of peripheral artery disease means, for the sometimes the signs of chronic limb ischemia. So if the person previous history of your peripheral artery disease will be there means, there will be signs of chronic limb ischemia will be there. Those are the signs like thickening of the toenails and then dorsum of the hand, that foot, that cessation of the hair growth over the dorsum of the toe and then foot will be there, muscle wasting will be there. Those are the some signs of the chronic limb ischemia. So what might be the differential diagnosis? Abdominal aneurysm, arthritis, DVT, scleroderma, and then soft tissue injury, systemic lupus erythematosus. How we can manage? So here in trauma and then everything we are following the two major important terms are there. First one is a life saving, second one is a limb saving. Limb saving. So here we have to follow the limb saving. So as soon as possible, we have to transport the person to the definitive care. So there will take the lot of procedure. We can they will go within some surgery to release that vascular agent. Otherwise, they will do the some graft, those other things. So if you are denying or treatment, otherwise if you are denying in a pre-hospital region itself means, the person may lose his limb. So as soon as possible you have to transport the person to the definitive care. So the same set of management here also we can go for any pain management based on your local protocol. We can go for the pain management, and then you are the patient compartment in our ambulance crew. The patient compartment should be the warm in nature. It should not be in a cold, because cold again induce the vasoconstriction, again it will cause the further complication. So and then third important thing, ischemic related burns, and then we should not apply any heat or cold over the area. And then if any acute limb ischemia required, rapid transfer to the closest appropriate facility you have to treat. And then we have to reassess the patient condition frequently, again 5 minutes, every 5 minutes you have to reassess, monitor the 5 P's. So in the positioning wise, we have, if the person have a pain over the lower region or you are suspecting occlusion over the lower limb means, you can ask the person and then sit and then tangling of the foot to the gravity, so to the ground. So that is the way, because of the gravity the blood flow will occur. So again if you are placing a person in a supine or leg elevated means, the further complication will arise, no. So for that reason you can ask the person to sit and then tangling of the foot over the ground, that will be increasing blood flow to your lower extremities. So third condition is a deep vein thrombosis. So thrombosis in the sense, the same thing, standby blood clot, localizing blood clots. So the localizing blood clot will occur in the deep vein means, that is the deep vein thrombosis. So if a clot develops in the deep vein in the extremities means, that is called the DVT, acute deep vein thrombosis. So deep vein means, again the another entity is a superficial vein, like a superficial and then deep. So superficial thrombophlebitis, that will occur in the veins near the surface of the skin. So the major important risk factor in the DVT is a pulmonary embolism. So major important complication in the DVT is a risk factor in the DVT is a pulmonary embolism. So the important, this is called the Virchow's triad, or three important factor predispose a person when the person will develop the thrombus. So when the person will develop the thrombus, risk factor for the thrombus. So otherwise we can call it as a Virchow's triad. So three major, the triad includes three things: venous stasis or sluggish blood flow, and then damage to the inner lining of the blood vessel, hypercoagulopathy. So the venous stasis, when it will occur in the case of pregnant or immobile for long period or bedridden, or those with obesity or heart failure cases. Damage to our inner lining of the wall, when it will occur any IV drugs we are taking, or venipuncture or inflammation or any trauma. So hypercoagulopathy, when it will cause because of certain type of cancer, it will cause dehydration or oral contraceptive. So this is called Virchow's triad. So assessment wise, the person will complain the major clinical manifestation in the DVT is swelling and then pain or tenderness in the affected limb. So here we have to look for the inflammation related sign. So this step, it is called the Homan sign. So if the person have a DVT in the lower limb, more specifically in the calf region, below the knee region, means there if you are dorsiflex the foot, means the person will complain or pain or tenderness over the calf muscle area. So that is the sign called the Homan sign. Commonly, it is not recommended assessment, because while the time of dorsiflexion, there may be a chance in the disruption of your clot. So the the stand-like clot can dislodge from the location, and then it can travel, and then it may cause the further complication. So for assessment purpose, for theory purpose, we can remember, but it is not recommended. Homan sign is not at all recommended. And then differential diagnosis: arthritis, cellulitis, muscle or soft tissue injury, superficial thrombophlebitis. So how we can manage? So again, if it is a definitive care, means there will place the inferior vena cava filter, and then if it is a pulmonary embolism related, means there will go some set of surgical related management. In pre-hospital, mainly they will approach with a complaint of, for if they are approaching for us, means mainly they will approach with a complaint of swelling in the affected area, or they will approach with a complaint of pulmonary embolism related thing. So based on the thing, we can manage. If the person complains is in pulmonary embolism, shortness of breath or chest discomfort, those are the main complaints in the patient, no? So based on that, we can treat. So otherwise, until unless the same steps we are following. So if the person need a pain management, means based on your local protocol, we can go with that. If you have opioid drug in your crew, means we can go with an opioid drug. And then mostly the person DVT can be transported to the closet appropriate facility as soon as possible. So the remaining things are the, again, every 5 minutes or as soon as possible, we have to reassess the patient. So do your best. Shalom.